Welcome everybody. My name is Dr. Peter Green, and I'm representing Sunsafe Nova Scotia. I'm the chair of that coalition, so I'm going to be hosting the webinar, and we'd like to thank everyone for taking the time out to join us here today. So we have a couple of, I think, really interesting talks, and I'll go through the background of each of them in detail. So Dr. Thomas Tenkate is an associate professor, director of the School of Occupational and Public Health at Ryerson University. And certainly has a lot of background, interest and involvement in this topic, having worked in Australia and the U.S. and fortunately for us now in Canada in environmental health, public health, and occupational health and safety, both at academic and government levels. He's been quite involved in various professional societies and was at one point a national president of Environmental Health Australia. He does have an ongoing active research interest in occupational exposure and risk management from ultraviolet radiation, and actually a new project titled Sun at Work, and Sunsafe Nova Scotia is a partner in that. We'll also hear from Patrick Curley, who holds a Master's of Public Health and has specializations in occupational and environmental health as well from the University of Alberta. And after completing his Master of Public Health, he completed his prior to completing his Master of Public Health, he did a BSc at University of Prince Edward Island. Now his background, professional and academic interest and expertise is in occupational environmental health, both quantitative and qualitative applied research and statistical analysis and project management. And so the content today specifically relates to cancer and chronic disease prevention, occupational environmental carcinogens, endocrine disruptors, occupational health and safety, risk assessment, and some background on nutrition. And last but not least, Brenda Marsh, who is currently the president of Occupational Health Nurses Association of Nova Scotia, is going to offer some reflections and comments on her experience addressing the ultraviolet issue in the workplace, actually just here in Nova Scotia. So just in terms of the procedure and process for this, the lines will be muted just to avoid any possibility of background disruptive noise. So sometimes cell phones, that kind of thing can cause some disturbance. There is a short evaluation at the end, so if you could please take time to complete that, we would really appreciate getting that feedback. We will be providing some time after each presentation for individual questions specific to the presenter, and that would be done via the chat function. So please put in your questions, and the presenter will answer those in sequence. If there are questions that we don't manage to address during the call, there will be an opportunity to get those answered in a written format afterwards. Keep in mind as well, the presentation will be accessible following the webinar. It will be recorded, and you'll receive an email from Amanda Babineau providing a link where you can retrieve that later. So that should be put up fairly quickly. So without further ado, I'd like to pass things over to Dr. Tenkate. If Dr. Tenkate, if you could unmute so we can pick up your sound there. And I don't think I'm hearing it so far.
Is that okay?
There, now we can hear you.
Great. Okay. Thanks very much. Appreciate the opportunity to present, and so thank you. Okay, there we go. I was just wondering if I could see the slides or not. So yeah, very much appreciate the opportunity to present, and so I've put together a range of slides here that I hope to cover sort of basically an overview on what issues are for solar UV exposure for outdoor workers, and I suppose try and make a case for why this is an important occupational health and safety issue. So if we can go to the next slide, thanks. So what I'd like to briefly cover, and I've got a lot of slides, so I know I have to motor on through these. But I just sort of thought I'd provide the range of slides so that, and they're all referenced, so people have this as a resource. So what I'd like to do is briefly talk about solar UV, health effects, what the literature says about outdoor worker UV exposure, talk briefly about control and protection measures, talk briefly about risk management, and then talk about offer some conclusions and future challenges. Okay, next slide, thanks. So one question is why is occupational UV exposure a concern? And so this quote comes from the European Agency for Safety and Health at Work, and what they do is they provide overviews or look at what they feel are emerging risks in occupational health and safety. And in 2009, they listed outdoor or UV exposure particularly for outdoor workers as one of their emerging risks. And the quote sort of highlights that they're saying it's one of the most significant physical risks in the working environment, mainly because there's a large number of people exposed. The risk seems to be increasing. There's not much information to provide a good picture on what the occupational exposure is, and that the legislative measures also don't seem to be sufficient to address the issue. So from a range of perspectives, they feel that it's a significant issue in Europe, and I think that this same sort of issues I would say relate also to Canada, the US, Australia, and in many parts of the world as well. So if we move on, next slide. So solar UV, next slide. So what factors influence solar UV at the Earth's surface? And I think we all have an understanding of these. So time of day, season, latitude, and altitude are the main ones. So time of day, so UV levels are higher at solar noon, so around the middle of the day, and drop off outside of sort of around a four-hour window around the middle of the day. The season, so higher levels in summer and much lower in winter. Latitude, so the higher levels closer to the equator and lower, and it drops off as the further you get away from the equator. And then altitude, so the higher the altitude, the higher the UV levels. So just to illustrate this, next slide, thanks. One of the ways that you'd be familiar with UV sort of levels is through a measure called the UV index. And so this is a measure to describe what's called erythemal UV exposure, so that's sunburning UV specifically. And so this is a sort of a public measure for the public to be able to put into broad categories of UV levels. And so they range from low, moderate, high, very high, and extreme. And so next slide, thanks. So for Canada, some typical values during summer are generally in the 7 to 8 range, so in the high and very high ranges. But in winter, these are basically in the low range. So next slide, thanks. So just to illustrate this, or illustrate some of these points, so this was a UV levels from the other day for Toronto, and then from a location in Hawaii, just to sort of illustrate a couple of points. One point is that aspect of the time of day. So you can see that for both locations, the time of day, that the peak is around noon, but they're quite substantially different UV levels because of the latitude and their location. So next slide, thanks. And just to illustrate this further, the latitude effect so the further you're going away from the equator, the lower the levels. And so these are UV levels mapped or UV index mapped across the North America, and this is for June, so in summer. And as you can see for Canada, we're primarily in the high and very high ranges, but getting more into the sort of extreme range the closer you get to the equator in the southern parts of the US. So next slide, thanks. But in comparison, in February, so in winter, you can see that much lower levels of UV across the continent. So next slide, thanks. And then you see this, and so this is UV levels for Toronto across the year. And so you can see that for quite a period of time, say April through September, we're in the high range, but and outside of that, we're in the low to moderate range in the tails of the curve. So it sort of highlights this aspect again of seasonality for UV exposure. And just I'll come back later on to talk about how this relates to in regard to protection measures and UV exposures as well. So next slide, thanks. So some health effects. So adverse health effects from solar UV are primarily associated with skin and eye conditions, both acute and chronic conditions. So acute conditions such as erythema or sunburn, but then chronic conditions such as chronic sun damage and various types of cancers. As for the skin, as well as a range of eye conditions. And this slide is really showing that the evidence for supporting the various conditions can vary. Most of the conditions there, we would say that there's sufficient epidemiological evidence to support the link between solar UV exposure and the development of the condition, but for other conditions the evidence isn't as strong. So next slide, thanks. Just to sort of illustrate some of these, this one is a recent case report of sun damage for a retired delivery truck driver who drove a truck for 28 years, and the case report is proposing that the sun damage to the the right side of the person's face is due to UVA exposure, so the higher wavelengths of UV coming through the window glass on the left-hand side of the person's face, and because that's the side, the driver's side of the vehicle. And so this really illustrates the potential for longer-term sun damage, and for some people this is can be quite a shocking illustration of the potential long-term effects of UV exposure, even though it's from a health perspective, it's not a great health burden. There's definitely the issue of the visual aspects and the potentially the impacts on someone's quality of life. So moving on, next slide. So UV and skin cancer. Solar UV has been categorized by both the International Agency for Research on Cancer as well as the US Department of Health and Human Services as the highest category of carcinogen, so a group 1 carcinogen, and being categorized as being a known human carcinogen. So it's really putting it up there as very much the evidence says that this is exposure to this will produce carcinogenic effects in humans. So moving on, so what are some statistics for UV and skin cancer? Worldwide, there's around 3 million cases of non-melanoma skin cancer and over 100,000 cases of melanoma each year. And so this equates to roughly 1 in 3 cases, cancers is a skin cancer. And globally, the incidence is continuing to rise. So it means that, and I think often people are sort of shocked about this sort of statistic, but the I suppose the main thing is that what are both the health and economic impacts of this large number of cases. And so in Canada, the incidence continues to increase each year. Non-melanoma skin cancers are the most commonly diagnosed cancer, at just over 80,000 cases each year, and around 320 deaths. And so what this means is that the mortality rate from non-melanoma skin cancers, what are the squamous cell and basal cell carcinomas, is not high. And so it means that early treatment is very effective. Melanoma, there's around nearly 6,000 new cases and just around 1,000 deaths a year in Canada. And the costs of this are currently over $530 million, so it's $530 million, rising to nearly $1 billion in the next 20 years or so. So the large number of cost and health impacts. How does occupational exposure relate? Both for squamous cell and basal cell carcinoma, some recent meta-analysis of various epidemiological studies have shown that there is a increased risk of both of these conditions with occupational exposure, and so the odds ratio there for both is above 1, and is also, because the confidence interval there does not include 1, it means that that is a significant exposure. And so, whereas what's interesting, you can see that the association is stronger for squamous cell carcinoma than basal cell carcinoma, and for squamous cell, they believe that it's still also underestimating the true exposure due to a range of confounding factors. So overall, the message is, for non-melanoma skin cancer, there's definitely, the evidence is that occupational exposure is a substantial risk factor. So next slide, thanks. What does this mean? So further, for non-melanoma skin cancer, some work from Australia indicated that there was around 34,000 new cases each year of non-melanoma skin cancer that were directly associated with occupational exposure, and across the board, the evidence is that occupational sun exposure is a significant risk factor for the development of non-melanoma skin cancer. I suppose if we move to melanoma, malignant melanoma, the associations are a bit more mixed, not as strong, with chronic exposure actually weakly associated. So and the various studies have also shown that occupational exposure is not actually associated, but the risk is increased for what is determined as intermittent exposure. And so it means that from an epidemiological perspective, the studies are showing more mixed results when it comes to malignant melanoma versus the non-melanoma skin cancer. But part of this, I think, is associated with the limitations in the epidemiological studies and various confounding effects, and particularly the idea that there's a self-selection bias associated with outdoor workers. So I suppose just want to put it out there that the evidence for melanoma is mixed, but the evidence for the non-melanoma skin cancer and occupational exposure is very strong. So moving on. So what does this, in regard to outdoor worker exposure, how many workers are, so look at it from a number of perspectives. So how many workers are exposed? Very recent information from Australia pitching at just over 2 million workers exposed on a regular basis to solar UV. In Canada, the figures range between 1.5 and 5 million workers exposed, and in Europe and Great Britain, also large numbers of workers estimated to be exposed to solar UV. It generally is sort of in the range of around the 10 to 20% of the workforce are identified as being exposed to solar UV on a regular basis. So next slide, thanks. So the National Sun Safety Survey that was conducted in 2006 through Canada found that for those people who were outdoor workers, 2/3 of the outdoor workers spent more than 2 hours a day in the sun, and 46% of the workers spent more than 4 hours a day in the sun. So this is a substantial exposure, and combined with this, a high proportion of outdoor workers also spent substantial time, or more than 2 hours a day in the sun for their recreational exposure. So it means that for outdoor workers, they're spending more time in the sun than indoor workers, both for work and in leisure time. And the surveys indicate that they're also more likely to receive sunburn. So it's just highlighting that outdoor workers, as an outdoor worker, they are exposed for a substantial period of time, both during their work time as well as they're more likely to have higher recreational exposure as well. So next slide, thanks. What is the hours of exposure per day? Again, in Australia, a survey showed that it was around 4 hours a day was an average exposure for workers who are identified as being outdoor workers, and this ranged. There was a range in different industry sectors, with agriculture and construction being the highest. And then in Canada, some recent information from Carrick's Canada has categorised workers into low, medium and high levels of exposure, with high exposure being categorised as spending more than 75% of their time outdoors, including farmers and construction workers. And they identified that 61% of outdoor workers were fitted into this high exposure category. So it means that a large proportion of the workers who are outdoor workers are getting high levels of exposure based on the number of hours per day they're exposed. So next slide, thanks. When we look at exposure levels, if we're wanting to relate this back to an exposure standard, there is an exposure standard produced by the ACGIH, what's the American Conference of Governmental Industrial Hygienists, and this was also adopted internationally by an international association called the International Commission on Non-Ionizing Radiation Protection. And it, I won't go into it in detail, but bottom line, it identifies that the standard represents conditions under which it's expected that nearly all individuals may be repeatedly exposed without acute adverse effects, and based on the best evidence, without noticeable risks of delayed effects. And so this exposure standard was based on acute effects and didn't take account of chronic effects such as skin cancer, but with the idea that if the exposures were below the level to cause acute effects, then you would also prevent delayed effects or chronic effects as well. So if we, next slide, thanks. This exposure standard, even though it's the same exposure standard, is actually interpreted slightly differently by both organisations. The ACGIH say that it's applicable to all sources of UV, including solar UV, but for the internationally, they interpret it to be interpret it differently, to say that it is an absolute limit for exposure to the eye, but because of a wide range of skin types, it's only advisory for the skin. And so there's a bit of a difference in interpretation of the standard, even though it's the exact same on the exact same standard from a scientific perspective. Next slide, thanks. So how is this adopted in legislation? So in Ontario, I know that the Ministry of Labour identifies that they apply the ACGIH standard, and so this means that they're applying this. It's applying to solar UV, and that this comes under their general, what I call their general duty clause versus a specific legislation. And so, but they do identify that measurement of UV is quite complicated and should be undertaken by someone who knows what they're doing. So, and we'll go into that in a little bit time. So next slide, thanks. So what does this mean for so what does all this mean? So I think this slide here is an important one. We talked earlier about UV index and how that in Canada during summer we're generally in the height of very high range, so the 7 to 8 UV index of 7 to 8. And so if we actually look at what does this mean for length of exposure to reach the exposure standard, we're at a UV index of 8. That relates to just under 10 minutes of exposure, and then to reach the exposure standard, what relates to just over 16 minutes of exposure to achieve sunburn. So I suppose what you'd have to say is that for a good proportion of Canada during summer, outdoor workers are going to be exposed to more than 10 minutes or 13 minutes. And so you'd have to say then that pretty much everyone's going to be receiving exposures above the exposure limit. And so then the question is, what do we do about that, or what should be done about that? But I think if people come back to this slide and sort of see that, well, yeah, from an exposure perspective, the exposure standard perspective, overexposure would be should be recognised as occurring in a large proportion of cases for outdoor workers. So next slide, thanks. So the next few slides are on actual studies of looking at outdoor worker exposure. So this slide looks at different categories of workers in different studies and how much of their exposure was as a proportion of the direct UV exposure from the sun, so percentage of ambient exposure. And you can see that across the board it ranged quite considerably, but there are going to be some activities where people can be exposed to much greater or a higher proportion than just direct exposure. So, say for pavers and tilers, they received 114% of what's directly exposed is coming directly from the sun. So this means that they're working in highly reflective environments, and so are receiving much higher UV exposures than what they would just from direct exposure. So next slide, thanks. And across the world, wherever exposures have been measured, they've been found to be exposure levels have been much over the exposure standard. So next slide. Control measures. We're familiar with the hierarchy of controls, and just sort of putting this out there that the level of effectiveness decreases as you go down the hierarchy, but for solar UV, we're really pushed into the least effective control measures because of because it's difficult to eliminate, substitute, or isolate. Use those measures. So next slide, thanks. So back to the UV index, you can see that between 7 and 8, what was our noontime exposure? Basically, we're saying that protection is required at those times. So next slide. The measures are a range of measures, but what we find is that a large proportion of workers don't take adequate protection with their face and arms, and least protected, and the use of sunscreen and hats is quite low. So next slide. I'll just quickly scoot through. There's limited evidence for what are the barriers and facilitators for implementing effective sun protection. And I won't go through that. There's a range of reasons for why people don't use sun protection or why it's difficult to implement it. Next slide, thanks. But overall, the recent evidence says that the evidence base is now sufficient to say that occupational sun safety programs can be effective in preventing overexposure and preventing skin cancer. So next slide, thanks. The cost effectiveness, when there's not much being done in regard to outdoor worker interventions, but broader interventions for the community or in school-based programs have shown that the return on investment is very good for the money spent on the protection measures. So from a cost effectiveness perspective, it is very, very cost effective to implement sun safety prevention programs. Next slide, thanks. So I've just some legal issues here that broadly, again, it's generally under a general duty clause for legislative obligations, and we're seeing that workers' compensation claims are increasing across the board. So next slide, I'll just quickly finish this and move on. So risk management, I just want to, next slide. So I want to just highlight that we should be placing the management of overexposure to solar UV within a risk management framework that includes workplace policy, employee training, an effective framework to identify, assess and control the exposures, as well as a piece on post-incident exposure. So we should really be placing it within a broad risk management framework that's already existing for a workplace. Next slide, thanks. And so just some overall conclusions that outdoor workers are exposed to levels that are above the exposure limit. They are at additional risk of developing skin cancer, and the control and prevention measures can be more difficult to implement. So I'll leave it there. So thank you very much. I know I've gone over time, and I apologise for that. So most happy to take some questions either now or later.
So thanks very much, Thomas. I think just in the interest of time, if it's okay, maybe we could defer questions to the end, just so we allow enough time.
Yes.
For Patrick.
Yep, no worries. Thank you.
Okay, and so with that, I'll let Patrick begin there.
Okay, great. Thanks.
So it just, Patrick, if you could press *7.
Okay.
Get you loud and clear. Perfect.
Okay, so everybody can hear me now. So thank you very much, Thomas, for your presentation. A lot of great information there. So today I'm going to talk a little bit about our Be Sunsible Outdoor Worker program here in Alberta. Next slide, please. So this is what I'd like to kind of quickly go through today. Okay, so next slide. Okay. So our sun safety efforts really began in 2009 when we conducted our situational analysis on skin cancer prevention, and we identified outdoor workers as a high-risk group. So you see here, these are skin cancer rates for Alberta in 2009, the last year that we have data from the Alberta Cancer Registry. With over 7,000 cancers, skin cancer is a very important issue here in Alberta, both from the sheer number of cases, but also from the burden that it places on the healthcare system. Next slide, please. So as you know, outdoor workers experience a substantial amount of UV exposure on the basis of their occupation, but also there's a range of other skin conditions and other health conditions that result in both short-term and long-term disability. Next slide, please. So a little bit about the outdoor worker demographics here in Alberta. You can see that over 27% of Albertans have a job that requires them to work outdoors, and also 73% spend more than 2 hours a day in the sun. Okay, next slide, please. Okay, so moving on to the Be Sunsible program. So the objectives of the program were to assist employers who inspire to reduce the impact of ultraviolet radiation exposure on their workers, for the outdoor workers themselves to see the sun as a hazard, and ultimately to reduce the rates of skin cancer in Alberta. Next slide, please. So one of the first activities we did with the program was to set up an industry advisory board. You can see there that we had a pretty diverse mix of participants. So the industry steering committee provided guidance with both the creation and the implementation of the program. They also helped to identify pilot sites for us. Okay, next slide, please. So when we originally created the program, we had certain industries and occupations in mind, specifically oil and gas, construction, and farming. But we since opened up the program to any employers that have a large proportion of outdoor workers. Okay, so next slide, please. So the program itself, it's definitely not a one-size-fits-all approach, but it's also more than just wearing sunscreen. So the first version of the program, we created a physical toolkit, seen there, that we went out to employers and we talked to them about the importance of sun safety. Based on the feedback that we got from the pilot sites that I'll talk about more in a moment here, we've since created a website, www.besunsible.ca. Next slide, please. Yeah, and so I thought I'd just kind of quickly go through some of the different steps or different components of the program. So the first step is really kind of setting up what the organization's commitment to the program will be, identifying workplace champions to really push the initiative, and then also being very clear about what time and resources will be committed to the program. Okay. Next slide, please. All right, so this is also kind of going back to what Thomas had spoke about there in the risk management framework. So really thinking about the sun as a hazard in the same way that you would for other hazards in the workplace. So for example, if you're going to be having a toolbox safety meeting at the first of the day to discuss the UV index and to make sure people know that they should be taking their breaks in the shade and things like that. Again, using the most appropriate control measures for the hazard, so looking at the hierarchy of controls, so moving from engineering controls, including things like shade structures, administrative controls, including altering work plans to avoid the hottest part of the day, and then also personal protective equipment such as sunscreen, hat, sunglasses, and also I'm going to discuss a little bit about the UVR bracelets that we provided participants to the program. Okay, next slide, please. So the Be Sunsible website has many downloadable resources that employers can use, including fact sheets, hazard assessments, posters to help promote the program, and then also one of the things that we strongly encourage is for employers to include sun safety resources in the new employer orientation, and also in those safety talks I mentioned. Okay, next slide, please. So one of the things about rolling out the program that we found was a lot of people really do want to talk about their experiences with working outdoors and in many cases with having skin cancers. We've also had people talk about some pretty serious near-miss incidents that have occurred due to heat exhaustion and other things like that. And it's really important to kind of empower the workers to talk about their experiences and to involve those stakeholders. Okay, next slide, please. So another way that the employer can kind of show their commitment to the program is by including sun safety into already pre-existing events. So for example, if you're going to have a company barbecue as an employee appreciation day, to include components about sun safety. So make sure that there's plenty of shade provided, plenty of water and things like that, and for the workers let the workers know that you're committed to the program. Okay. Next slide. So here's just kind of a range of some of the different personal protective equipment that we did suggest to people to use. And then you can move to the next slide there. One thing I wanted to kind of highlight was these UVR bracelets that we provided. These are a good visual reminder of the intensity of the sun, and they change color based on the UV index. And then you can also get these UV bracelets where you apply sunscreen to them, and when they change color, that's to let you know it's time to put on more sunscreen. So again, just kind of a fun visual reminder to the workers about how strong the sun is. Okay, so just the 2012 summer pilot project. As I mentioned before, the Industry Steering Committee assisted us with helping to identify 11 pilot sites across Alberta to participate. So that was about approximately 2,500 outdoor workers. So during the pilot project, one of the first things we did was meet with the interested company, took some demographics about the company, kind of what the different types of occupations would be. We then set up a train-the-trainer meeting with the resource toolkit that I showed you there before, with typically an occupational health and safety person that would be the worksite champion. Then we, throughout the summer, conducted some hazard assessments or some site visits to give them recommendations. We also provided them with some of those functional promotional materials, and then also asked them to participate in a wrap-up evaluation study at the end of the summer. And we're looking for feedback from them about how to improve the program. And one of the things that we did find was that they were asking for an online resource, and so a website where they could kind of download a lot of those different resources that I mentioned. So here's an example of one of those sun safety hazard assessments that we conducted. This was a large water amusement park in Edmonton, and you can kind of see here some of the things we identified, that there was no shade provided for the lifeguards. Workers are not wearing hats and sunglasses. Quite frankly, a lot of the times these people would see it as a great way to get a tan over the summer. And then there's also the reflection of UV and heat off the concrete, and then also a reflection of UV off the water as well. All right, so next slide, please. So this is kind of moving on to the 2013 program launch that we had last March. We had events in both Edmonton and Calgary, and we wanted to really highlight and promote the Be Sunsible website. Here in Alberta, we have numerous certifying partners, so they're kind of the occupational health and safety groups that are responsible for different industries, and we were lucky enough to have some of those certifying partners come on board and really promote the program to their membership, and that was really effective. In all, we had probably over 40 large employers participate in the launch and in the program last summer, and that comprised over 25,000 outdoor workers. I also just wanted to quickly show you here, this was from a outdoor pool facility in St. Albert, town of St. Albert, and one of the cool things that they did was post the UV index every day. They trained their employers about how to access that information through Environment Canada. We also have the UV index posted on the Be Sunsible website through a link to Environment Canada every day. And this was a good thing for both the employees, but also for the users of the pool too, to know how strong the sun was that day. Okay, next slide. So just some quick kind of lessons learned from our experiences with the program first. The first picture there is that one of the occupational health and safety trade shows and conferences that we attended with the Be Sunsible program. And again, we had a lot of people that were really interested in the program. They definitely came up to us and told us that they saw value in what we were doing, and again, really kind of shared their experiences. The other picture there, the picture in the middle, is one of those certifying partners that participated in the program was the Alberta Motor Transportation Association. So that's a lot of truck drivers and delivery people. And I definitely learned a lot about their occupation. And I know previously, Thomas, you mentioned that CareX had identified them as being low exposure, but they also did talk a lot about, as part of their job, they have to, they're responsible for securing their loads and kind of washing the vehicles, taking the vehicles to the weigh stations and things like that, and so they do have a lot of outdoor time. And to be completely honest, I didn't think that this would be a very receptive group to my presentations, but they were very interested and very keen to learn about the exposures and what they could do to protect themselves. The final picture there is from the City of Lethbridge Police Department fund run, and they just kind of going back to showing your commitment to the program. We were really excited by them promoting the program both to the workforce and then also to other citizens too that participated in those fund runs and things like that. And next slide there. And just kind of a final slide, this is our booth that we kind of go to the different trade shows and things like that, and just with the tagline of what's missing from your safety plan. So again, trying to get people to think about the sun as an occupational hazard the same way that they would with other hazards. Okay, I think that's the last slide. Great.
Thanks very much, Patrick. So maybe if I could open it up for, I guess I'm going to wait, and maybe we'll wait for questions. I just wanted to give Brenda a chance to present, and then we'll take questions.
Okay, well, I'll do this quickly because I know there's some great questions out there. So from as an occupational health nurse and a safety professional, I've addressed sun safety for outdoor workers from prevention to the early detection to the rehabilitation. And as you've heard from Patrick and Dr. Tenke, some things are really important. We know that the risk assessment is important. We need to identify where the hazards are, which employees are at higher risk, where are the higher exposures. And once we identify that, obviously it's something that we can't eliminate in most workplaces, but we need to work on our administrative controls. So can workers do the outdoor work earlier in the day or later in the evening? Can they do their data inputting when the UV is highest during the day and go indoors to do that? I worked highways, and we would have steel bridge crew workers, and they would work under the bridge or on the shaded side at the peak of the day. So there's lots of things that you can do to help to reorganize your administrative part of your work. Lots of personal protective equipment out there, of course. We always talk about sunscreen. It's important. I worked highways where workers would wear sunscreen because it was greasy. It had a scent to it. So now you can buy it unscented and greaseless, which is great. Other things, of course, are the hats that are really important. Back flaps, brims are really important for them to know about. Sunglasses, key. Wraparounds are really important. I've seen more problems with the eyes and cataracts in the last 10 years than I've ever seen in the workplace. It's interesting to see that, but certainly sunglasses are important. Health Canada on their site under sun safety lists the CSA standards that they have for non-prescription sunglasses. They divide their sunglasses into cosmetic versus general purpose versus special purpose, which a lot of our workers do need. So those are some things to think about. And with the sunglasses, I always recommend the neck retainers if you want them to keep them. We use these safety sunglasses where I work now. They're much less expensive, and they do the trick. They meet most of the CSA standards. So those are some things to think about. There's some great websites. Certainly the Canadian Dermatology Association has some really good resources, and we'll put the resource page together and we can send that to you. They have a progress tracker for your sun safety policy implementation, which is a really great tool for the workplace. So where to begin and where to end, and it walks you through it. They have the sensitivity test online, which a lot of my workers, from both highway workers to scientists where I work now, really appreciate that. They take that home to their families as well. And they also have the list of recognized sunscreens that you'll find helpful. And with the sunscreens, I always say check the expiry date, because if the supervisor ran to the drugstore to get it and picked it up because it was on sale, there's a chance that it might expire this month. So have a look at that. There's lots of educational videos on YouTube that are literally 3 to 5 minutes, great to show to employees. And Health Canada has their sun safety section, which I'll send you the link to as well. And certainly Patrick talked about the Sun Sensible site that he's got. It's awesome. You have to go there. Well worth it. And in a nutshell, I guess that's a pretty fast spiel. On screen now you'll see the sheet that we have, our fact sheet for Nova Scotia. And that's a certainly condensed summary of what we have for all the stats, but it's in one place. There's some great posters that I'll reference when I send out the reference that you can download from the Canadian Derm site as well. That's about it. I don't want to go too far because we want to do questions and answers for sure. So before I leave, though, I do want to thank Dr. Tancade and Patrick and Dr. Green for participating today. I know that it's a very busy hour to take out of the day, midday in Nova Scotia for sure, but I do appreciate it on behalf of the Occupational Health Nurses Association. And now we'll go to questions.
Thanks very much, Brenda. So I'll open it up for questions. If anyone had any, you can type in, you can text in. Julian asked if you could share the slides, and I think we will be able to do that, and plus the presentation will be posted afterwards. So they will be made available. So did anyone have any specific questions for Dr. Tancade or Patrick, Brenda? I'm going to ask one just while we're waiting for people to type in. I just had a question quickly for Patrick. I thought the bracelets were a really neat idea. And I'm just curious in terms of two things. Number one, the cost. And number two, at what UV index level do they change color?
So there is a lot of different North American suppliers of them. The company that we used was Sunband in the UK, and I forget what the unit cost was, but we did buy in bulk for the program, so it would be kind of one of those issues where based on the number of products that you're going to get, I think they were something in the range of maybe $1 or $2 per bracelet, but they do last for a considerable amount of time. We did have the City of Edmonton kind of do a little bit of an evaluation on them and how long they worked and things like that. As far as the change in color, they actually will change color continuously. And so on the side they have the different shades which represent the different UV readings. And so they'll start off with white and then they'll just get darker as the UV intensity increases. Okay, so they actually, the color changes correlate with a known color coding for UV index. Yeah, they won't kind of change the colors that are typical of the UV index, but they will, for example, like there were blue ones and there were purple ones, and they'd get darker shade of blue and purple based on the UV readings. And we did do a little bit of analysis there, and it was actually pretty close. You know, we'd know what the UV index was for the day, and we'd go take them outside and see if they'd work. And yeah, so you can actually kind of just see in the picture there that based on the color there, they'll get darker, and underneath that there's actually it'll say the UV reading that corresponds. Okay, great. Thank you. I'll open it up again for any other questions. I don't want to hog the questions, but I also want to take advantage of the expertise that's in front of us. But I did have a question for Thomas. I think probably, Thomas, one of the most difficult things for us to explain to patients, and it's certainly something that the tanning industry has latched onto, is the lack of association of chronic outdoor exposure with melanoma. And you know, certainly you highlighted some of the studies that in fact show a negative association, so people tend to latch onto that. And I appreciated the background of what you were
commenting on about self-selection and the limits of some of the studies and confounding variables. So I guess I'm not sure if there's any other way to explain it than that, but it does appear that sometimes for us it's a little harder to explain risk of UV exposure with that information that we have in front of us.
Yeah, yes, I agree. I think the aspect of the association between UV exposure and the development of melanoma. So the development of melanoma is definitely associated with UV exposure. The issue is the sorts of studies that we have available to us to be able to show the link with outdoor worker exposure means that there's limitations in that study design. And so it's, in essence, what it's saying is that my sense is that it's not that it's not happening, it's just that we can't show it given our current study designs.
Right, and I certainly agree with you. I can see that clinically in terms of same with basal cell, and when in some instances where there hasn't necessarily been a strong association, yet the people I'm seeing for basal cell carcinoma, certainly outdoor workers, people who spend a lot of time outside, have an overrepresentation of those sorts of problems. So I guess it's one of those things that we believe it's there and we know it's there, but showing it is more challenging.
Yes, that's correct. Yes.
Thank you. So we have a minute or two left if anyone has any last-minute questions. Again, if it's something you think of afterwards, or you want to maybe go some questions, you're welcome to do so. So without hearing or seeing any further inquiries, I think I'll leave it at that. And once again, I'd like to thank everybody for their time and participation, for people for listening in, and we really hope that you take away some of this information and use it. And again, thanks to all our speakers today for their involvement.
Thank you very much.
Thank you.
Thank you. Please stand by.